Hey there, Dr. Andrew Merrill here at Nightlight Chiropractic, and I typically do these Wednesday night wellness live videos, but it's Thursday, just around noon. We're just starting to see some patients here in a minute, and I wanted to talk to you about kidney stones today. And it's kind of a weird topic. I get it. I'm a chiropractor. I don't treat kidney stones, but we see a lot of kidney stones here, and we see these kidney stones because the most common presenting complaint is back pain, right? So a patient comes in, they say, I've got some back pain, can you help me? And then we'll do an exam, and during that exam, we find some pain in their flank, so I'll kind of lower back off to the side, and we determine that they have kidney stones and we can't help them and we need to send them off to a medical facility. So the medical facility typically will give you some medication for pain, and they might give you some medication to dilate your urethra so that you can pass this kidney stone. But today I'm going to talk to you about two novel treatments, one to prevent the formation of kidney stones, and the second to actually pass the kidney stone. These are very alternative treatments, and they're fantastic. I swear to God, this is real research. I have the papers right here that I can show you. So these are alternative, and I guess these would be considered kind of strange, but they're fantastic. So bear with me here. Let's talk about kidney stones first. So kidney stones should probably really be called kidney crystals. What ends up happening is in your urine, there's a bunch of particulates, right? So calcium and oxalate and uric acid, and sometimes they come together in just the right chemical combination to form crystals. And those crystals sit there and they get stuck inside your kidney. Your kidney's meant to have fluid running through it, and then the fluid is not running through it suddenly, and the crystal develops and then kind of sits there and forms a stone, a kidney stone. The problem with that kidney stone is that it's lodged in there, and then eventually it needs to kind of scrape its way all the way down through, and then you pass that kidney stone if you're lucky, right? If the kidney stone gets too large, what ends up happening is it becomes lodged in there, and then you need medical intervention for it to come out, right? Whether it's lithotripsy, they use some sound waves to bust it up, or they actually go in there surgically and pull it out. So unfortunately, the incidence of these kidney stones is increasing, right? And it happens to both men and women, and it's horribly painful. If you look at some of the other videos on YouTube that talk about this, some people call it the most painful thing that you could possibly have as a medical condition. I'm not sure that that's true, but they throw it out there. The other thing that I noticed on YouTube is you can find a lot of crazy recipes for how to prevent or maybe how to cure some of these kidney stones. Be careful with some of these things. So what I'm going to talk to you about here today, there's some research behind it. I can show you the research paper. This isn't like chiropractic research. This isn't like alternative research. These are from respected peer-reviewed journals that we're talking about here. So this is not just me shooting from the hip. There is some research behind both of these. So let's jump right into it, right? What are we going to do to prevent kidney stones? Here's what we're going to do. We are going to take a liter of water, right? And it doesn't have to be smart water. It can be any old dumb water. It doesn't have to be any specific pH water either. In fact, I'd argue it shouldn't talk about pH, because what we're going to add to this liter of water is one lemon. So you're going to cut this lemon, you're going to take it, you're going to squeeze the whole thing into this liter of water, and you're going to do that every single day. And what that's going to do is it's going to change some of the chemistry that's happening in your urine so that crystals can't even form, right? So forget anything else. Forget, I saw a video about somebody boiling carrots and raisins and all kinds of mush, and it was like this big sloppy like cooking mess. Forget all that. Just squeeze a lemon into a liter of water every day. Drink the whole liter of water. Doesn't matter what time of day it is. And that's going to help you to never form a kidney stone again. Now, you have to buy a lot of these, right? If you're going to use one every day, you end up buying a lot of them. A distant second place would be getting some lemon juice, so some concentrate or some lemon juice from concentrate. You can use that and add like maybe an ounce or so to your liter of water and get similar type results. Although in the research, like I said, there is research to this. In the research, they used a fresh lemon. So understand, we want to follow the research as best we can. I would use a fresh lemon into some water. Hi, Miss Paula, how are you? Happy Thursday afternoon to you. So that's how we're going to prevent having kidney stones ever again. So we're going to do that in addition to all the other kind of medical literature talks about changing your diet a little bit, right? So sodas, really not so good for you. Spinach is high in oxalates. You want to be careful with that. You want to be careful with some of the other foods that you might be eating, including potato chips. Apparently potato chips are really high in oxalates. So if you want to avoid getting kidney stones, avoid the sodas, avoid the potato chips, and avoid the dark alcohols. So what are we going to do if we actually get a kidney stone? And this is fantastic. This was actually the idea behind this whole talk here today. What are we going to do if we have kidney stones? Well, first you should present to your medical doctor, and they'll start you on some painkillers, and they might start you on something to dilate your urethra. But then the other thing, and I'm not even kidding, this is real research, and here's the actual name of the study, right? So this is a mouthful to say, so I'm just going to splash it up on the screen, and you can kind of read it on your own. But the last most important part is basically they were treating passing kidney stones by having patients ride on a roller coaster. Which roller coaster, you might ask? Well, it says right here, Big Thunder Mountain Railroad roller coaster. Big Thunder Mountain Railroad, that's like right down the road from me here. That's like a half hour away. If you're anywhere in the Central Florida region here, near my office, right in the middle of downtown Orlando, you can drive down, get yourself a day pass to Walt Disney World, and then ride Big Thunder Mountain Railroad, because what they found was that between 40 and 55% of people who are riding Big Thunder Mountain Railroad were passing their kidney stones. And then they recreated that again and again and again with this like artificial sciencey type kidney to show exactly how it works. Here's the thing, you want to sit in the middle to the back of Big Thunder Mountain Railroad, and it doesn't even matter if you have a small kidney stone or a middle-sized kidney stone or where it even is in the kidney, you're going to pass this kidney stone. I couldn't make this stuff up if I tried. If you go ride Big Thunder Mountain Railroad, you're going to pass your kidney stone. That's crazy talk. That's just insane to me, but here it is, black and white in the research. I can link the research to the end of this post. I think that would be a good idea so that you know that this video is not just one of those shoot from the hip, boil your carrots to treat your kidney stones. Anyways, so prevent the kidney stones, drink water with lemon, change your diet a little bit. If you have the kidney stone, get on down to Walt Disney World and jump on Big Thunder Mountain Railroad a few times around, and you will pass that kidney stone. That's all I have for this evening, but like I said, I found a workaround to this Facebook Live video, so you're going to see me on here again every single Wednesday evening at 8 o'clock for another Wednesday Night Wellness Live. That's all I have. Thank you for watching. Good to see some of you guys on here. I will see you next time. Have a great day.